Yasin Magombe. I'm the director of AD Innovations, working in partnership with the Association of Obstetricians and Gynecologists of Uganda. Agenda ya Olwaleero was about sharing information on prevention of maternal mortality and morbidity. Why do we have to discuss about prevention of maternal mortality and morbidity? Over time, through research that the Association of Obstetricians actually found out, we have so many mothers and young girls who are losing their lives or getting serious complications that affect their uterus that they may not even bear children in the future. Why? Because of getting unintended pregnancies and attempting to terminate those pregnancies using crude methods. Why do they use crude methods? It's because the law on abortion restricts which categories of people are supposed to undertake such services. Therefore, if someone, either a woman out there or a young girl, conceives, but they do not know what they're supposed to do and they don't understand what the law says, that's when they resort to doing crude ways of ending pregnancies. Now, the challenge is that these women and young girls don't have the right counseling, because it's not always necessary that once you get an intended pregnancy, the solution is to terminate the baby. The issue is that counseling can help a mother carry on that baby. Counseling can help someone have a changed mindset. Counseling can help actually women and mothers out there, or actually even sharing information, help these mothers to know that, oh, if I know that I'm sexually active, I need to protect myself by use of contraception. Government allows contraception. There are different family planning methods, short-term, mid-term, and long-term methods, which can help mothers actually not end up into unwanted pregnancies. So today's workshop that we had with cultural leaders, part of the policymakers, health workers, local leaders, and the media, was that since these are the people who are in close contact with the people in our communities, we would want them to go and add a voice out there. We would want them to share this information with the mothers so that parents, mothers, and the young girls know the facts about sexual reproductive health. And the Association of Obstetricians and Gynecologists of Uganda, AOGU, takes on this mandate, and it works with AD Innovations, which is a CPO registered here in Bale, in Vungo-Kosabu County. So the workshop focused majorly on trying to share the facts about sexual reproductive health in terms of contraception. How can women protect themselves so that they avoid complications that come up with unintended pregnancies when they do illegal abortion, but also to share what the law in Uganda talks about in regard to the limits under which doctors can perform surgical abortion, so that it helps people to be empowered, but also to let the leaders here go out there and act as champions of cascading information. To the question that you asked about the provisions under which a young girl or a woman can do abortion legally, as provided under the 2006 policy guidelines, these are the instances. One, if a girl or a woman is raped and incidentally she gets pregnant. Two, if it is through the act of incest, a family member abusing a young girl sexually and the girl ends up pregnant. Under our cultures, that is not allowed. So the law provides for such. Three, in cases of defilement, if a young girl or a woman has been defiled, there a child does not belong to any father who is going to support this young girl or woman, to raise such a baby. So the law has a provision for that. Also, in cases of severe maternal illnesses, where a mother, upon diagnosis by doctors, they realize that this mother's life is in danger. So they feel like the woman is safer only when they end the pregnancy. Also, in circumstances where a mother is pregnant and she has a severe cardiac disease, that is heart issue complications, you know, it is allowed that for the mother to stay safe, then they have to end the pregnancy. Also, in terms when there are issues to do with the kidney disease, that is going to be a threat to the, to the mother and the child, then they have to end it. Also, in circumstances where we have a situation what we call severe preeclampsia. Eclampsia is more like pressure developing around maybe the 50th month, 60th month. It's common usually around that stage. And the mother goes into convulsions, And because of such, it is a very serious threat that the mother actually can lose her life, plus the baby. So medically, it is allowed for doctors to recommend such. And then once the doctors do scans through routine checks of mothers going for antenatal, they realize that the unborn child has some mental abnormalities, which are going to be a threat actually when the child is born. It is recommended that because of such, they can end the pregnancy. Then, another circumstance is when a woman has brain abnormalities, the deformation of the brain and the skull, meaning that child, even if she came onto earth, because the brain is damaged, it is not going to sustain a life. So it is better actually to save the mother by ending that pregnancy. And last but not least is when a mother is diagnosed with cervical cancer. Cervical cancer affects the uterus. That is where the child is stored or in the womb. So in the process, definitely she cannot have a good pregnancy. And lastly, the law provides that if a mother is HIV positive, and given her circumstances, her living circumstances, she cannot be in position to hold another baby. And she requests that, not given my HIV status, I'm not in a position to do it. The law provides for such a woman to be given attention to. So those are the only circumstances under the law that it has provided for abortion to be, given to the mothers to safeguard their life.
What are some of the challenges that ladies face when accessing services of abortion?
Some of the challenges, one is because not all health workers actually have information about this law. And that's why we had this workshop, which was involving some of the health workers, specifically the midwives, so that they can go and share the same voice. Because most of the people know that entirely abortion or ending a pregnancy is illegal. But here we now see some of the limitations whereby it can be performed. But it also says that this should be performed by a well-trained medical doctor with reasonable care and skill, and after a thorough assessment, not just walking into a facility and then someone demands. No. The second challenge, besides the midwives or health workers not having the law and therefore denying services for some of these people, maybe who got pregnant out of rape or incest or defilement, the other issue is the attitude. Through research that was conducted by AUGO, we realized that there are some health workers who haven't been trained on how to handle communication relating to sexual reproductive health. Most times, for instance, if the young girl was pregnant out of incest and she walks into a facility, maybe a midwife or a health worker would begin by blaming them. And once you blame, then this girl will have no other alternative. And most times that's why they end up seeking services of unsafe abortion. Yet their case can be handled by the facility. So lack of the right attitude to engage these young girls with such complications is an issue that makes these people actually not go to facilities. There's also the issue of lack of thorough counseling. Again, there are circumstances whereby when we have women in the facilities, it is always ideal that our health workers keep talking about the use of contraception and then also informing the mothers about how to use family planning methods, especially if they want to avoid unintended pregnancies. But because of limited training that the health workers, and truth be told, we cannot blame the health workers. It's about how much proactiveness facilities have taken, and maybe the government, through its implementing partners, have trained some of these health workers so that one, they have the right counseling skills, they have the right communication, they have a mindset that is focused on care of the patients and so forth. But the biggest issue is the lack of clear information and knowledge about sexual reproductive health. If people knew how to do the prevention, there's even no need to talk about terminating the pregnancy because we have family planning, we have contraception, we have the early morning pills, that gives actually a woman who didn't have maybe unprotected sex avenues to use so that they don't have to fear about the issue of terminating a baby. So this lack of information, there are organizations that are doing this proactively, but the population is so big, and then sometimes people are restricted with budgets to reach out to the last village in the given community. And we have most of these people actually who lack this information, and that is where the problem is. The only solution that comes into their mind when they conceive is, where can I get a traditional healer? And then they end up getting issues. Complication is, by the time they are walking into facilities, the situation is so severe. The other challenge is about actually our communities criminalizing the word abortion, so that people fear to talk about it. And once you fear, then it means you cannot help the people because of the fear. So those are some of the circumstances, and the purposefully, this particular workshop was to engage the local leaders, the policymakers at district levels, the midwives at facilities, some of the VHT peer leaders who coordinate the rest of the VHTs, to see how we can improve the healthcare system, either through referrals for people to go and gain good counseling, or people to get the right information, so that people don't work in panic, or people don't just send away young girls and mothers, deny them services. Yeah, because they are ignorant. So it's about ignorance, one, of the law, two, ignorance on facts about sexual reproductive health services. Absolutely. But of course, there are quite some others, like when you engage the mothers, they will say they would want to take contraception, but there are health workers in some facilities. There could be few who ask for money, and this mother doesn't have money to take a family planning method, or they want to remove a method and they now give birth, and then some health workers say, you have to give me some money before I can help you with that. Now, when we continuously keep requesting for these unprivileged mothers and young girls money, then we are denying them to have access to quality health care. So they end up actually into seeking services of the traditional healers, and evidence from the health workers has showed us that some of these young girls end up dying due to excessive bleeding from complications, or some of them have gotten damaged uteruses and they can never bear children. So the effort is to add voices out there so that people know the facts, so that health workers change their thinking, so that the policymakers do the right, policies that can help to safeguard the young girls and the mothers who are in need of support. To have the local leaders talk to the people, so that the people know what they're supposed to do, and also embrace the services brought on by government in terms of family planning, in terms of contraception, services brought by implementing partners. We have organizations like Maristops, Reproductive Health Uganda, Population Services International. Now, for us as AD Innovations, our role is to do health promotion. And specifically today, it was about sharing so that we can add voices of others who are important to help the mothers and the young girls in the communities.
How many lives do we lose as a result of this kind of thing of abortion, especially illegal?
Okay, I wouldn't really want to state that because it requires engaging the DHO's office because they have the right statistics of some of the complications they deal with, and then maybe eventually the mothers die. But of course, on the internet platforms, when you go to Google, Ministry of Health shares some of this information. But these issues keep happening every now and then. So it is only vital that when we engage the office of the district health officer, they can, because they collect information on a monthly basis from all the facilities, say in the district, and then at Ministry of Health from the country. So it would be good to have actually valid data so that we can share and people get to know facts. And since we are media here, we can always dig into such information by going to the district to really get the percentages so that we can share with the community to know that this is a serious problem.
Thank you, sir.
Thank you so much, please.